Millions of Americans turn 65 every single year, and almost every one of them ends up asking the same question: why does Medicare feel so confusing? It's supposed to make life easier as you age, but for many people, signing up feels like you've stepped into a maze with too many doors and not enough signs. And that's exactly why we're doing this video today, to make Medicare simple. Whether you're turning 65 soon, already on Medicare, or helping a parent or spouse navigate the system, this quick guide to Medicare Basics will give you the clarity you've been looking for. But before we jump in, I want you to do one thing for me. Comment your name and state below. I'd love to see who's watching and benefiting from these videos. I read every single comment. Let's start by taking a breath and understanding what Medicare really is. People hear so many terms: Medicare, Medigap, Advantage, Part D, Part C, Part B, deductibles, penalties, and it becomes overwhelming. But at its core, Medicare is simply health insurance for people who are 65 and older, and for some people under 65 with disabilities. That's it. It's not the government controlling your care, it's not taking away your doctor, and it's not replacing your private coverage unless you want it to. Medicare is meant to give you a foundation, and from there, you get to choose how much protection you want and how much risk you're comfortable with. I talk to people every day who say, "I wish someone explained this to me sooner." I once had a woman in Texas tell me she delayed Part B because she thought she didn't need it since she never goes to the doctor. 2 years later, she had to sign up after her husband's insurance ended, and she had no idea she was facing a lifetime late enrollment penalty. And she told me, "No one warned me." Not once. And that's exactly why understanding the basics matters, because Medicare rewards people who plan, and it penalizes people who get confused or misled. So let's make it simple. Medicare has 4 basic parts: A, B, C, and D. It sounds like school grades, right? But it's actually pretty straightforward. Part A covers hospital care. That's your room, your meals, the nurses, and the emergency situations that land you inside a hospital bed. Most people get Part A for free because they paid into Medicare during their working years. Part B is your doctor visits, your outpatient care, lab work, procedures, preventive screenings, and everything in between. That one comes with a monthly premium, which for most people in 2025 is $174.70, and for 2026 it's expected to rise again because of increasing healthcare costs. Part D is drug coverage. And Part C, which most people know as Medicare Advantage, is a private insurance alternative that bundles everything under one company. Here's where many people get tripped up. They think Medicare automatically covers everything the way their employer insurance did. But Medicare has gaps, big ones. And that's why choosing between Medicare Advantage and Medigap is one of the most important decisions you can make. It shapes your healthcare for the rest of your life. Let me give you a real example. I once helped a man named Robert from Florida. He was 66, recently retired, and very healthy. He told me he never takes medication, rarely gets sick, and travels constantly. So he figured Medicare Advantage made sense since it had $0 premiums and a whole list of extra perks. But here's the twist: 3 months later, while visiting family in Arizona, he had a medical scare. Under original Medicare, he would have been covered anywhere in the U.S. Under his Medicare Advantage HMO, the hospital he went to was out of network, and he got hit with thousands of dollars in bills. And he told me afterward, "I didn't realize Medicare Advantage had limits based on region. I thought Medicare was Medicare." That's why learning the basics gives you power. Advantage plans have networks. Plans in one state don't follow you everywhere. PPOs give more flexibility, but you still pay more when you go out of network. And HMOs are even stricter, you have to stay within their network if you want coverage. On the flip side, original Medicare with a Medigap supplement lets you go to any doctor or hospital in America that accepts Medicare, and that's over 90% of providers nationwide. No referrals, no prior authorizations, no networks. Now let's talk about something many people misunderstand: costs. Medicare isn't free. Yes, Part A might be free for most people. But Part B isn't. And in 2026, the Part B premium is projected to increase again because of rising drug costs and higher outpatient spending. That's one reason knowing your plan matters. If you choose Medicare Advantage, your Part B premium still applies. The commercials talk about $0 premiums, but they don't tell you that your Part B amount is still mandatory. And if you delay Part B when you shouldn't, Medicare charges a penalty that never goes away. I once spoke to a gentleman in California who postponed Part B because his neighbor told him it wasn't necessary unless he was sick. By the time he learned the truth, he owed a 30% penalty for life. And he said to me, if I had known, I would have enrolled right away. These stories happen every single day. That's why understanding Medicare Basics is not optional, it's essential. Another big decision people have to make involves prescription drug coverage. Part D is not automatic. Some people think, I'm not taking any medications right now, so I don't need a drug plan. But Medicare charges penalties if you delay Part D without credible coverage. And more importantly, medications can become expensive overnight. I talked to a woman from Ohio who was perfectly healthy at 65, no prescriptions at all. By age 67, she was diagnosed with rheumatoid arthritis and one of her medications cost $2,400 a month. Without Part D, she would have paid almost all of that out of pocket. Instead, because she enrolled early, her plan covered nearly everything with just the monthly premium. And here's the good news, 2026 brings some major drug coverage improvements thanks to the Inflation Reduction Act. One of the biggest changes is the new $2,000 out-of-pocket cap for prescription drugs. That means no matter how expensive your medications are, you'll never pay more than $2,000 per year under Medicare Part D. This is a huge step forward, especially for people with chronic conditions, cancer medications, or specialty drugs. So if you felt overwhelmed by drug prices in the past, 2026 will bring some real relief. Now, let's talk about Medigap for a moment, because this is one of the areas that confuses people the most. Medigap is supplemental coverage, it fills the gaps that Medicare Parts A and B don't pay for. These plans are lettered to Plan G, Plan N, and so on. Plan G is the most popular because it covers everything except the Part B deductible. Medigap doesn't have networks. It doesn't require referrals. And it never changes its benefits, what you sign up for stays the same year after year. But here's the catch, you usually need to sign up when you first become eligible. If you try to sign up later, you may have to answer health questions, and if your health has changed, the company can deny you. That's why planning early makes a difference. People who choose Medicare Advantage early sometimes struggle to switch back to Medigap later because of health conditions. Others who choose Medigap early sometimes switch to Advantage because they want extras like dental or vision. And speaking of dental, 2026 is bringing some interesting upgrades. Many Medicare Advantage plans are expanding dental coverage because seniors have complained for years that Medicare doesn't cover comprehensive dental care. In 2026, expect to see more Advantage plans offering better dental benefits, including deeper coverage for crowns, extractions, and possibly even major dental work, though limits will still apply. These enhancements are a response to rising demand and increased pressure on insurers to offer more meaningful extras, not just basic cleanings. But remember, even better dental benefits don't mean everything is covered. Advantage plans have caps. They might cover $1,000 or $2,000 per year, but major work can go far beyond that. And those shiny extras, vision, hearing, dental, can distract people from the more important factors, like network rules, authorizations, and out-of-pocket maximums. And that brings up another key point. Medicare Advantage plans can change every single year. Premiums, copays, doctors, benefits, everything can shift. That's why the annual notice of change matters. In 2026, we're expecting more restructuring than usual because insurance companies are tightening costs, adjusting networks, and shifting benefits after years of high claims and financial pressure. Some insurers are already shrinking their Medicare Advantage footprints or exiting certain counties altogether. That means some plans people rely on today won't exist in 2026, and choosing the right replacement plan becomes critical. Now, I want to address something people rarely think about: emergencies and hospitalizations. Original Medicare is simple: if it's medically necessary, it's generally covered. Under Medicare Advantage, many services require prior authorization. That means the insurance company reviews the request before approving the service. It's not automatically granted based on your doctor's order. This can lead to delays, and for some people, delays mean worse outcomes. The government has documented millions of prior authorization denials every year within Medicare Advantage plans. Not all of them are justified. Some get reversed after appeals, but those appeals take time. I once worked with a family whose father needed a skilled nursing facility after a surgery. With original Medicare, it would have been covered. Under their Medicare Advantage plan, they faced hurdles because the insurer initially denied the request, stating it wasn't medically necessary. They had to wait almost a week while the family appealed the decision, and in that time, the patient was stuck in the hospital, getting weaker. That's the dark side of prior authorizations. They're meant to control costs, but sometimes they create obstacles that feel deeply unfair. Now, to be fair, Medicare Advantage does work extremely well for many people. If you're healthy, have predictable medical needs, visit in-network doctors, and want those bonus benefits like dental, hearing, or gym memberships, an Advantage plan can be a great fit. It caps your costs with an out-of-pocket maximum and can save you money up front. Many people love their Advantage plans, and there's nothing wrong with that. The key is knowing what you're signing up for and understanding the trade-offs. Meanwhile, original Medicare with a Medigap plan is often better for people with chronic conditions, people who travel frequently, snowbirds who live in 2 states, or anyone who wants maximum freedom in choosing providers. It costs more upfront, but it can save you enormous money and headaches in the long run. The biggest message I want to leave you with is this: Medicare is not one size fits all. The right choice depends on your health, your budget, your doctors, your travel habits, and your comfort with networks and authorizations. Learning the basics gives you control, and in 2026, with all the changes coming, that control matters more than ever. If this video helped you understand Medicare more clearly, make sure you're subscribed and stay tuned. We post updates every single week to help you navigate your Medicare journey with confidence. And if you're ready to explore more Medicare topics, the next videos on your screen will guide you even further. You're not alone in this. We're here to make Medicare simple, one video at a time.